Question 1. Radiation protection. Emergency preparedness and response. In the event of a radiological emergency at a nuclear power plant, the response team must follow established protocols to minimize exposure and protect public safety. Which of the following actions aligns with IAEA's emergency preparedness and response guidelines? A. Immediate mass evacuation of all individuals within a 50 kilometers radius without assessment of radiation levels. B. Public communication should be delayed to avoid panic until all radiation levels are fully analyzed. C. Implement shelter-in-place orders when radiation levels exceed action thresholds and initiate evacuation only when necessary. D. Radiation workers should continue their tasks without protective gear to operational delays. Answer. C. Implement shelter-in-place orders when radiation levels exceed action thresholds and initiate evacuation only when necessary. Explanation. IAEA emergency preparedness guidelines emphasize a graded approach in radiological emergencies. Mass evacuation is not the first response, as it can lead to unnecessary exposure and logistical chaos, eliminating option A. Instead, shelter in place is advised when radiation levels exceed limits but are not yet high enough to require immediate evacuation. Evacuation decisions are based on dose assessment and modeling projections. Public communication must be timely and transparent to prevent misinformation and panic, eliminating option B. The IAEA mandates early warning systems and public advisories rather than delaying information. Radiation workers must follow dose constraints and personal protective protocols. GSR Part 7, ensuring exposure remains as low as reasonably achievable. ALARA, eliminating option D. Unprotected work during a radiation event is a violation of safety principles. Question 2. Non-destructive testing. Ultrasonic testing. Which of the following factors most significantly affects the accuracy of flaw detection when using ultrasonic testing in non-destructive evaluation of concrete structures? A. The thickness of the concrete sample being tested. B. The experience and qualification of the NDT technician performing the test. C. The frequency of the ultrasonic transducer used in testing. D. The ambient temperature at the test site. Answer. C. The frequency of the ultrasonic transducer used in testing. Explanation. Ultrasonic testing relies on high-frequency sound waves to detect internal flaws in concrete and other materials. The frequency of the transducer directly affects penetration depth and resolution. Higher frequencies e.g. 210 MHz provide better resolution for detecting small flaws but have less penetration depth, while lower frequencies MHz penetrate deeper but with reduced resolution. This makes transducer frequency a critical factor in flaw detection. While concrete thickness option A influences wave attenuation, transducer frequency selection is the key factor in ensuring both flaw detection capability and depth penetration. The technician's experience option B is important for data interpretation, but even an experienced operator cannot compensate. Poor frequency selection. Ambient temperature option D has minor impact, as ultrasonic velocity is only slightly affected by temperature variations in solid materials. EDT guidelines highlight transducer selection as a crucial step in ensuring accuracy and reliability in ultrasonic testing. IAEA Training Course Series No. 17. Question 3. Scenario-based radiation oncology treatment planning. Dr. Patel is a radiation oncologist designing a radiotherapy treatment plan for a 65-year-old patient diagnosed with locally advanced head and neck cancer. The patient has pre-existing kidney disease, making nephrotoxic chemotherapy agents contraindicated to ensure optimal tumor control while minimizing damage to surrounding organs. Following strategies should Dr. Patel implement? A. Use intensity modulated radiotherapy IMA to precisely target the tumor while sparing healthy tissues. B. Increase radiation dose significantly beyond standard levels to compensate for the lack of chemotherapy. C. Use a single high-dose fraction to complete treatment in one session to minimize prolonged radiation exposure. D. Avoid radiation treatment altogether due to the patient's comorbidities and instead rely on palliative care. Answer. A. Use intensity modulated radiotherapy IMA to precisely target the tumor while sparing healthy tissues. Explanation. For patients with locally advanced head and neck cancer, standard treatment often includes chemoradiotherapy. However, in this case, chemotherapy is contraindicated due to kidney disease, making radiotherapy the primary treatment modality. IMIT option A is a gold standard approach in modern radiation oncology because it allows precise dose distribution, minimizing radiation exposure to critical organs such as the spinal cord, salivary glands, and kidneys. Increasing radiation dose significantly. Option B, beyond evidence-based guidelines, risks excessive toxicity and long-term complications without proven benefit. The IA recommends adhering to established dose constraints for critical organs, IA Tech Doc 1588. A single height fraction option C is not suitable for advanced cancers as it can lead to severe acute toxicity. Instead, fractionated treatment is preferred to allow normal tissue repair. Avoiding radiation altogether. Option D is not justified as the patient requires definitive treatment. While palliative care is critical in end-stage cases, this patient has a potentially curable condition with proper radiation therapy. IA Safety and Effectiveness Guide. Recommend tailored radiotherapy planning using advanced techniques like IMIT to maximize tumor control while reducing toxicity. Question 4. Radiation protection. Occupational radiation exposure. Radiographer working in an industrial setting regularly conducts X-ray inspections on metal welds. His daily tasks involve using high-energy radiation sources, often in enclosed or shielded environments. After reviewing his annual radiation dose report, the facility's radiation protection officer, Uriot, notices that his cumulative exposure is approaching the annual dose limit for radiation workers set by the IA. What actions should the REO take to ensure compliance with IA General Safety Requirements GSR Part 3 regarding occupational exposure? A. Immediately suspend the radiographer from performing further radiation-related work until the next monitoring period begins. B. Recalculate the dose using alternative monitoring methods, such as biological dosimetry, to verify the accuracy of the recorded dose. C. Implement administrative controls, such as rotating duties or limiting exposure times to ensure the worker does not exceed the regulatory limit. D. Reduce radiographers' work hours, but allow him to continue operating the X-ray equipment under direct supervision. Answer C. Implement administrative controls, such as rotating duties or limiting exposure times to ensure the worker does not exceed the regulatory limit. Explanation. The IGSR Part 3 establishes dose limits to protect radiation workers from excessive exposure. For occupational exposure, the annual effective dose limit is 20 MSV per year, averaged over 5 years, with no single year exceeding 50 MSV. Suspend worker option A is unnecessary unless exposure has exceeded regulatory thresholds. The goal is to prevent excessive dose accumulation, not remove workers arbitrarily. Recalculating dose with biological dosimetry option B is not a standard practice unless there is suspicion of monitoring errors or radiation accidents. Reducing work hours alone option D may not be sufficient. The best approach involves dose optimization, includes administrative controls like duty rotation, shielding improvements, and real-time dose monitoring. The correct response aligns with the as low as reasonably achievable ALARA principle, emphasizing dose optimization while ensuring operational continuity. Question 5. Non-destructive testing. Radiographic film interpretation. In radiographic testing, RT of weld joints in high-pressure pipeline and inspect to detect series of dark, irregular indications along the fusion line of weld. These indications appear as elongated, non-uniform shapes that do not have clear geometric structure. Based on ENET training guidelines, which of the following most accurately describes the cause of these indications? A. Porosity caused by trapped gas bubbles during the welding process. B. Incomplete fusion caused by improper heat input or contamination during welding. C. Slag inclusion resulting from improper slag removal between welding passes. D. Tungsten inclusion typically occurring in GTOR TIG welding processes. Answer B. Incomplete fusion caused by improper heat input or contamination during welding. Explanation. Radiographic interpretation relies on understanding defect characteristics. Porosity, option A, appears as rounded, evenly distributed dark spots, which is not the case here. Incomplete fusion, option B, manifests as dark, irregular indications along the fusion line. This occurs when the welding arc fails to properly bond base metals, often due to insufficient heat or contamination. E.g., rust oil or oxide layers. Slag inclusions, option C, appear more structured, often following the weld bead, and are typically seen in multipass welds. Tungsten inclusions, option D, are typically bright, not dark, on a radiograph because tungsten has a high atomic number, making it appear denser than surrounding material. According to AIA's non-destructive testing guide, accurate defect classification is critical for determining repair or rejection criteria. Question 6. Radiation oncology. Image-guided radiotherapy IGE. Hospital is implementing image-guided radiotherapy IGE to improve the precision of radiation delivery for lung cancer patients. This technique integrates imaging with radiotherapy to adjust for tumor motion and anatomical changes during treatment. Which of the following is the greatest advantage of IGE in treating lung cancer? A. It allows for dose escalation beyond conventional limits without increasing toxicity to healthy tissue. B. It eliminates the need for immobilization devices as real-time imaging compensates for patient movement. C. It improves target accuracy by accounting for respiratory motion and daily anatomical variations. D. It reduces overall treatment duration by replacing fractionated radiotherapy with single-dose delivery. Answer: C. It improves target accuracy by accounting for respiratory motion and daily anatomical variations. Explanation: lung tumors move due to respiration, making precise radiation delivery challenging. IGE enhances targeting accuracy by tracking real-time tumor position changes, ensuring that radiation doses delivered to the tumor while sparing surrounding healthy lung tissue. Dose escalation, option A, is possible with IGE, but requires careful planning to avoid toxicity. Eliminating immobilization devices, option B, is incorrect. IGE complements immobilization rather than replacing it. Replacing fractionation with single-dose delivery, option D, is not applicable to lung cancer, which typically requires fractionated radiotherapy. AIA's radiation oncology guidelines recommend IGE for tumors in anatomically mobile regions as it improves targeting precision while maintaining patient safety. Question 7. Radiation protection. Emergency response in nuclear accident. Nuclear power plant experiences partial reactor core meltdown, leading to the release of radioactive isotopes into the environment. The plant's radiation protection team is tasked with implementing emergency response measures in accordance with AIA safety standards for nuclear and radiological emergencies. Which of the following actions should be the first priority in response to this emergency? A. Evacuate all personnel within 50 kilometers radius, regardless of radiation exposure levels. B. Immediately deploy radiation monitoring teams to assess the extent of contamination and exposure. C. Distribute potassium iodide to all individuals in the affected area to prevent thyroid uptake of radioactive iodine. D. Establish protective barriers and containment zones to minimize further radiation spread. Answer: B. Immediately deploy radiation monitoring teams to assess the extent of contamination and exposure. Explanation: according to the AIA General Safety Requirements GSR, Part 7, the first step in any nuclear emergency is to assess the situation through radiation monitoring to determine the level of exposure and contamination. Evacuating all personnel, option A, is premature without assessing actual radiation risks. Unnecessary evacuation can cause chaos and increase risks of injury. Administering potassium iodide, option C, is only effective against radioactive iodine exposure and should be done based on exposure risk assessments. Setting up protective barriers, option D, is a secondary response after confirming radiation spread patterns. Emergency protocols prioritize accurate radiation assessment to inform appropriate protective actions. Question 8. Non-destructive testing. Eddy current testing for aircraft inspection. An aviation maintenance team uses eddy current testing to inspect an aircraft's aluminum fuselage for fatigue cracks that may compromise structural integrity. The inspection reveals variations in electrical conductivity and phase shifts in the eddy current signal at certain locations. Based on NET guidelines, which of the following is the most likely cause of these variations? A. Changes in the thickness of the aluminum skin due to corrosion. B. The presence of non-metallic inclusions within the material. C. Interference from external electromagnetic fields affecting the eddy current signal. D. Surface roughness, which prevents proper probe contact with the metal. Answer: A. Changes in the thickness of the aluminum skin due to corrosion. Explanation: Eddy current testing is highly sensitive to variations in material thickness and conductivity. Corrosion option A reduces material thickness, leading to detectable conductivity changes. Non-metallic inclusions option B are more relevant in bulk metal processing rather than in service aircraft inspections. Electromagnetic interference option C can affect readings, does not cause localized signal shifts consistent with fatigue cracks. Surface roughness option D can impact testing quality but does not cause conductivity variations. According to IA's NET training manual, ECT is widely used in aircraft maintenance to detect thinning from corrosion and fatigue cracking. Question 9. Radiation oncology. Ethical considerations in palliative care. 65-year-old cancer patient with advanced stage lung cancer is undergoing palliative radiation therapy to reduce tumor size and alleviate symptoms. However, the patient's condition is deteriorating and he expresses his wish to discontinue treatment due to the burden of side effects. As radiation oncologist, how should you ethically respond to this situation under our radiation medicine guidelines? A. Continue treatment regardless of the patient's wishes, as radiation therapy is the standard of care for symptom management. B. Respect the patient's autonomy, provide counseling on potential benefits, and support his decision. C. Seek legal intervention to determine whether treatment withdrawal is justified. D. Transfer the patient to another oncology center for second opinion before considering treatment discontinuation. Answer. B. Respect the patient's autonomy, provide counseling on potential benefits, and support his decision. Explanation. IA's radiation medicine guidelines emphasize patient autonomy in treatment decisions. If patient chooses to discontinue treatment, the healthcare team must respect this decision while ensuring the patient understands all medical options. Forcing treatment option A violates ethical principles of patient consent. Intervention option C is unnecessary unless competency is questioned. Seeking second opinion option D may delay necessary palliative care adjustments rather than addressing immediate patient needs. This scenario highlights the ethical balance between medical recommendations and patient rights in palliative radiation therapy. Question 10. Radiation protection. Shielding design for radiotherapy facility. New radiotherapy center is being constructed, and the design must ensure that radiation exposure to workers and the public remains within IA safety limits. The facility will house linear accelerator, linear emitting 6 MeV X-rays. Which of the following factors is most critical when determining the required shielding thickness for the treatment room? A. The workload, use factor, and occupancy factor of adjacent areas. B. The material properties of the linear accelerator's collimator. C. The distance between the radiation source and the treatment room walls. D. The average number of patients treated per day. Answer. A. The workload, use factor, and occupancy factor of adjacent areas. Explanation. According to IA Safety Report Series No. 47, shielding design must consider workload W, the total radiation output of the machine per week, use factor U, the fraction of time radiation is directed at a particular barrier, occupancy factor T, the fraction of time a space is occupied by personnel or the public. Option B is incorrect because while collimators shape radiation beams, they do not determine wall shielding requirements. Option C is a contributing factor but not the most critical compared to workload and occupancy considerations. Option D is incorrect because patient volume does not directly define shielding needs. IA shielding guidelines ensure safe radiation exposure levels for healthcare workers and the public. Question 11. Non-destructive testing. Radiographic testing in pipeline inspection. In industrial pipeline carrying high-pressure gases being inspected using radiographic testing (RT) to detect internal defects such as cracks and corrosion pitting. What is the main advantage of using gamma-ray radiography over X-ray radiography for this type of inspection? A. Gamma-ray sources provide higher resolution images. B. Gamma-ray radiography allows for portability and field use without electrical power. C. X-ray sources pose higher radiation exposure risks than gamma-ray sources. D. Gamma-ray radiography is safer because it does not require radiation shielding. Answer. B. Gamma-ray radiography allows for portability and field use without electrical power. Explanation. According to IA's NDT guidelines, gamma-ray radiography is ideal for industrial pipelines because Gamma-ray sources such as iridium-192 and cobalt-60 are self-contained and do not require electrical power, making them suitable for remote or hazardous locations. Option A is incorrect because gamma-ray radiography typically has lower resolution than X-ray radiography. Option C is incorrect because both X-ray and gamma-ray sources pose radiation risks, requiring controlled use. Option D is incorrect because gamma-ray sources still require shielding and radiation safety protocols. Gamma-ray radiography is widely used in pipeline integrity assessments due to its portability and deep penetration capabilities. Question 12. Radiation oncology. Image-guided radiotherapy IGIT versus conventional radiotherapy. Radiation oncologist is treating patient with head and neck cancer. The team decides to use image-guided radiotherapy IGIT instead of conventional radiotherapy to enhance precision. Which of the following best explains why IGIT is superior for this type of treatment? A. IGIT uses real-time imaging to account for tumor movement and patient positioning errors. B. IGIT delivers higher radiation doses than conventional radiotherapy. C. IGIT eliminates the need for immobilization devices during treatment. D. IGIT reduces treatment costs by shortening radiation exposure time. Answer A. IGIT uses real-time imaging to account for tumor movement and patient positioning errors. Explanation. IGIT integrates imaging GET, MRI, or ultrasound during treatment to track tumor position, reduce errors, and improve dose accuracy. Option B is incorrect because IGIT does not inherently increase radiation dose. Option C is incorrect because immobilization devices are still required to minimize movement. Option D is incorrect because IGIT is typically more expensive due to added imaging steps. Guidelines recommend IGIT for tumors in areas prone to movement, e.g. lung, prostate, head, and neck cancers. Question 13. Radiation protection. Handling and transporting radioactive waste. Nuclear medicine facility generates low-level radioactive waste, still including contaminated syringes and gloves. According to IA's waste safety standards, what is the correct disposal procedure for this type of waste? A. Mixing it with general hospital waste after sufficient decay time. B. Sealing it in lead-lined containers and storing indefinitely on site. C. Transporting it to an approved disposal facility following regulatory guidelines. D. Diluting radioactive waste with water before disposal into the sewage system. Answer C. Transporting it to an approved disposal facility following regulatory guidelines. Explanation. IA Safety Guide GIA G1 mandates that radioactive waste must be classified, stored, and disposed of safe allowable be transported to a licensed disposal facility under strict regulatory control. Option A is incorrect because mixing with general waste is prohibited due to contamination risks. Option B is incorrect because on-site indefinite storage is not a long-term solution. Option D is incorrect because dilution is not an acceptable disposal method for radioactive waste. Proper radioactive waste management prevents environmental contamination and public health risks. Question 14. Non-destructive testing. Acoustic emission testing in bridge inspections. Structural engineer is conducting acoustic emission testing to detect internal defects in steel bridge. The test reveals high-amplitude transient signals during heavy truck loads. What do these signals most likely indicate? A. Crack propagation or material failure in the steel structure. B. Ambient noise interference from traffic and wind. C. Changes in material density due to temperature fluctuations. D. False reading caused by sensor misalignment. Answer A. Crack propagation or material failure in the steel structure. Explanation. According to IA's NDT training materials, it is used to detect stress-induced defects in structures. High-amplitude transient signals indicate active crack propagation. Option B is incorrect because ambient noise does not produce localized emission signals. Option C is incorrect because temperature changes affect material expansion but do not generate acoustic emissions. Option D is incorrect because sensor misalignment would produce inconsistent data rather than sharp signals. EAT is widely used for structural health monitoring of bridges, pipelines, and pressure vessels. Question 15. Radiation protection. Dose limits for occupational workers. Hospital radiation technologist works with fluoroscopy and CT imaging on daily basis. According to IA Basic Safety Standards, BSS, what is the maximum allowable annual radiation dose limit for an occupational worker? A. 10 MSV per year. B. 20 MSV per year, averaged over 5 years, with no single year exceeding 50 MSV. C. 50 MSV per year with no cumulative limit. D. 100 MSV over 10 years with no single year restriction. Answer: B. 20 MSV per year, averaged over 5 years, with no single year exceeding 50 MSV. Explanation: according to IAS Safety Standards DSR Part 3, occupational radiation exposure is limited to 20 MSV averaged over 5 years, 100 MSV total with a maximum of 50 MSV in any single year. Option A is incorrect because 10 MSV is the public exposure limit, not the occupational limit. Option C is incorrect because 50 MSV is an upper limit, but long-term exposure must be averaged. Option D is incorrect because limits are set for 5-year periods, not 10 years. These limits protect workers from long-term radiation risks, including cancer and tissue damage. Question 16. Non-destructive testing. Ultrasonic testing. In aircraft inspection, an aerospace engineer is using ultrasonic testing to inspect the wings of commercial jet for fatigue cracks. Which of the following best describes why UT is preferred for aircraft inspections? A. It can detect both surface and subsurface defects with high precision. B. It requires minimal operator training compared to other NDT methods. C. It does not require coupling media like gel or water for sound transmission. D. It is the only method that can detect the laminations in composite materials. Answer: A. It can detect both surface and subsurface defects with high precision. Explanation: according to EDT training guidelines, it is preferred in aviation for detecting cracks, delaminations, and corrosion. It uses high-frequency sound waves to identify internal defects that are invisible to visual inspection. Option B is incorrect because it requires specialized training due to data interpretation challenges. Option C is incorrect because that does require a coupling medium to transmit sound waves into the material. Option D is incorrect because other methods, e.g. thermography and radiography, can also detect delaminations, but is widely used in aircraft safety inspections to prevent catastrophic failures. Question 17. Radiation therapy. Stereotactic body radiation therapy (SRT) in lung cancer. Radiation oncologist is considering stereotactic body radiation therapy (SRT) for patient with early-stage non-small cell lung cancer (SLC, with SRT preferred over conventional radiotherapy in such cases. AORT delivers high-dose radiation in fewer sessions with precise targeting to minimize damage to healthy tissue. ESRT eliminates the need for tumor imaging before treatment. C. AORT allows for continuous radiation delivery over several weeks. D. SRT is only effective for large tumors and is not suitable for small lung cancers. Answer: AORT delivers high-dose radiation in fewer sessions with precise targeting to minimize damage to healthy tissue. Explanation: according to IA guidelines on advanced radiation therapy, SRT delivers very high doses, hypofractionation in 1-5 sessions, reducing treatment time. Uses precise imaging guidance to reduce radiation exposure to surrounding healthy lung tissue. Option B is incorrect because imaging is essential in SRT for tumor localization. Option C is incorrect because SRT is not continuous. It involves short, high-dose sessions. Option D is incorrect because SRT is most effective for small, localized tumors. SRT improves survival rates and reduces side effects compared to conventional fractionated radiotherapy. Question 18. Radiation protection. Controlling exposure in nuclear medicine. Nuclear medicine technologist is preparing 99 radiopharmaceutical for patient SPECT scan. Which method is most effective for reducing radiation exposure to the technologist? A. Minimizing time, maximizing distance, and using appropriate shielding. B. Eliminating the use of personal dosimeters to reduce unnecessary alarms. C. Standing close to the patient during radiopharmaceutical injection. D. Using lead-lined gloves to completely block radiation exposure. Answer: A. Minimizing time, maximizing distance, and using appropriate shielding. Explanation: according to our radiation protection principles, exposure control follows the lower as low as reasonably achievable principle, minimizing time spent near radiation sources, maximizing distance inverse square law reduces exposure, using lead shielding, syringe shields, lead aprons, and barriers. Option B is incorrect because dosimeters are required for radiation monitoring. Option C is incorrect because standing near the patient increases exposure. Option D is incorrect because lead gloves reduce exposure but do not completely block radiation. Proper protection methods ensure safe handling of radiopharmaceuticals in nuclear medicine. Question 19. Non-destructive testing. Eddy current testing, ECT in power plants. Technician is performing eddy current testing, ECT on heat exchanger tubes in nuclear power plant. What is the primary advantage of ECT over ultrasonic testing up for this application? A. ECT can detect small cracks without direct contact with the surface. B. ECT can penetrate thick metal components better than A. C. ECT is not affected by electromagnetic properties of materials. D. ECT is the only method capable of detecting corrosion. Answer. A. ECT can detect small cracks without direct contact with the surface. Explanation. According to ENET guidelines, ECT is preferred for inspecting heat exchanger tubes because it detects small surface and subsurface cracks without requiring direct contact. Option B is incorrect because it penetrates deeper into thick materials than ECT. Option C is incorrect because ECT relies on electromagnetic properties to function. Option D is incorrect because other methods, e.g. radiography, also detect corrosion. ECT is widely used in nuclear and petrochemical industries for corrosion and defect detection. Question 20. Radiation detection. Using Geiger counters versus scintillation detectors. Laboratory is measuring low-level radioactive contamination in research facility. Which type of radiation detector is best suited for this task? A. Scintillation detectors, because they have higher sensitivity to low-energy radiation. B. Geiger-Müller (GM) counters, because they provide precise radiation energy measurements. C. Neutron detectors, because they can detect all types of radiation equally. D. Ionization chambers, because they are ideal for detecting very short half-life isotopes. Answer. 8. Scintillation detectors, because they have higher sensitivity to low-energy radiation. Explanation. According to IA safety standards, scintillation detectors are used for low-level contamination detection because they provide high sensitivity to weak gamma and beta emissions. Option B is incorrect because GM counters detect radiation presence but are not energy sensitive. Option C is incorrect because neutron detectors are used for fast neutron detection, not contamination. Option D is incorrect because ionization chambers are suited for high radiation dose measurements, not low-level contamination. Scintillation detectors are essential for environmental monitoring and contamination control. Question 21. Radiation shielding. Concrete versus lead for gamma radiation. Nuclear power plant is designing radiation shielding barrier for gamma radiation source. Engineers must decide between lead and concrete for the barrier. Which of the following factors is the most important consideration when choosing between lead and concrete? A. Lead provides greater shielding per unit thickness, but concrete is more cost-effective for large structures. B. Concrete is always better gamma radiation shield than lead due to its higher density. C. Lead and concrete offer equal protection against gamma radiation, so the choice is based on availability. D. Lead is more effective for neutron shielding, or concrete is best for gamma rays. Answer. A. Lead provides greater shielding per unit thickness, but concrete is more cost-effective for large structures. Explanation. According to IA radiation protection guidelines, the choice between lead and concrete depends on: lead is denser, providing superior shielding per unit thickness. Concrete is cheaper and more practical for large-scale structures. Option B is incorrect because lead has a higher density, 11.34 grams skim, and concrete 2.3 grams skim, making it better gamma shield per unit thickness. Option C is incorrect because shielding effectiveness varies based on material properties. Option D is incorrect because lead is not effective for neutron shielding. Materials like water or borated polyethylene are better for that purpose. Concrete is commonly used in nuclear power plants because it is cost-effective and can incorporate additives to enhance neutron shielding. Question 22. Non-destructive testing. Advantages of digital radiography doctor over film radiography. An aerospace manufacturer is switching from film radiography to digital radiography doctor for weld inspections in aircraft components. Which of the following best explains why digital radiography is preferred over conventional film radiography? A. Digital radiography provides faster image acquisition and enhanced image processing capabilities. B. Digital radiography does not require any radiation source for image formation. C. Digital radiography is only useful for detecting defects in soft materials. D. Digital radiography completely eliminates the need for trained radiographers. Answer: A. Digital radiography provides faster image acquisition and enhanced image processing capabilities. Explanation: according to IA non-destructive testing (NDT) guidelines, digital radiography doctor offers several advantages: faster image acquisition, instant results without film processing, image enhancement, contrast adjustment, zoom and digital storage, low radiation dose requirements compared to film radiography. Option B is incorrect because doctor still requires X-ray or gamma-ray sources. Option C is incorrect because Doctor is effective for both soft and hard materials. Option D is incorrect because trained professionals are still required for image interpretation. Doctor is widely used in aviation, manufacturing, and power plants due to its efficiency. Question 23. Radiation protection. ALARA principle in industrial radiography. Technician is performing gamma radiography on pipeline using an iridium-192 source. Which of the following best demonstrates the application of the ALARA as low as reasonably achievable principle? A. Using collimators and shielding to minimize radiation exposure. B. Increasing the exposure time to capture clearer image. C. Eliminating personal dosimeters to avoid unnecessary exposure reports. D. Standing as close to the source as possible to monitor the imaging process. Answer: A. Using collimators and shielding to minimize radiation exposure. Explanation: the ALARA principle minimizes radiation exposure through time, reducing the duration of exposure, distance, maximizing distance from the source, inverse square law shielding, using lead or tungsten collimators to direct radiation. Option B is incorrect because increasing exposure time raises radiation dose. Option C is incorrect because dosimeters are mandatory for radiation monitoring. Option D is incorrect because standing closer increases exposure unnecessarily. Industrial radiographers must follow ALARA to ensure safety. Question 24. Radiation therapy. Image-guided radiation therapy (IGIT) in cancer treatment. Radiation oncologist is using image-guided radiation therapy (IGIT) to treat patient with prostate cancer. Why is IGIT preferred over conventional radiotherapy for tumors in moving organs? A. IGIT continuously monitors tumor position and adjusts treatment in real time. B. IGIT does not require any imaging before treatment delivery. C. IGIT uses higher radiation doses than conventional therapy, making it faster. D. IGIT is only effective for brain tumors and is not used for prostate cancer. Answer: A. IGIT continuously monitors tumor position and adjusts treatment in real time. Explanation: IGIT uses real-time imaging (MRI) or fluoroscopy to ensure accurate radiation targeting by adjusting for organ motion (e.g. lungs, prostate, gastrointestinal tract). Patient positioning as. Option B is incorrect because IGIT relies on imaging to guide treatment. Option C is incorrect because IGIT focuses on precision, not higher doses. Option D is incorrect because IGIT is used for many cancers, including prostate cancer. IGIT improves treatment accuracy and reduces side effects. Question 25. Nuclear accidents. Lessons from Chernobyl and Fukushima. Following the Chernobyl 1986 and Fukushima 2011 nuclear disasters, what major safety improvements have been implemented in modern nuclear reactors? A. Passive safety systems that cool reactors without operator intervention. B. Increased use of graphite moderators similar to those in Chernobyl. C. Elimination of emergency core cooling systems to simplify reactor design. D. Replacing all nuclear power plants with fossil fuel alternatives. Answer: A. Passive safety systems that cool reactors without operator intervention. Explanation: according to EA post-accident reports, key improvements include passive cooling systems e.g. water reservoirs that work without electricity, stronger containment structures to prevent radiation leaks. Option B is incorrect because graphite moderators contributed to Chernobyl's runaway reaction. Option C is incorrect because emergency cooling is critical for meltdown prevention. Option D is incorrect because nuclear power remains key energy source. These upgrades reduce the risk of future accidents. Question 26. Radiation exposure. Occupational dose limits in industrial settings. Worker in nuclear power plant is exposed to ionizing radiation as part of their job. The plant's radiation safety officer must ensure that the worker's annual radiation exposure does not exceed regulatory limits. According to International Commission on Radiological Protection (ICAP) guidelines, what is the maximum allowable annual dose for radiation worker? A. 50 millisieverts MSV per year. B. 100 millisieverts MSV per month. C. 250 millisieverts MSV per year. D. No dose limits apply to occupational radiation workers. Answer: A. 50 millisieverts MSV per year. Explanation: regulatory agencies like the ICAP and the U.S. Nuclear Regulatory Commission (NRC) set occupational exposure limits. Radiation workers: maximum dose of 50 MSV per year. General public: limited to 1 MSV per year, excluding medical exposure. Option B is incorrect because 100 MSV per month would exceed safe limits. Option C is incorrect because 250 MSV per year greatly exceeds international safety standards. Option D is incorrect because dose limits are strictly enforced to protect workers. Proper dosimetry monitoring and ALARA principles help maintain worker safety. Question 27. Radioactive waste. Storage of high-level nuclear waste. Country is planning the construction of long-term repository for high-level radioactive waste obliterated from nuclear power plants. Which of the following best describes the safest method for long-term disposal? A. Deep geological storage in stable rock formations. B. Discharging liquid waste into the ocean to dilute radiation levels. C. Burying waste in shallow landfills near population centers. D. Storing radioactive waste in above-ground containers indefinitely. Answer: A. Deep geological storage in stable rock formations. Explanation: according to IAEA and NRC guidelines, the safest method for high-level waste disposal is deep geological repositories, e.g. Finland's Onkalo repository. Stable rock formations, e.g. granite, clay, salt domes prevent radiation leaks. Long-term isolation for 10,000 years until radiation levels decrease. Option B is incorrect because ocean disposal is illegal under international treaties, e.g. London Convention 1972. Option C is incorrect because shallow burial is unsuitable for it remains dangerous for millennia. Option D is incorrect because above-ground storage is temporary solution, not long-term disposal method. Deep geological storage ensures environmental protection and long-term safety. Question 28. Radiation shielding. Neutron attenuation in nuclear reactors. Nuclear reactor engineer must design shielding to protect workers from neutron radiation emitted by the reactor core. Which material would be the most effective neutron shield? A. Water or polyethylene, because they contain hydrogen atoms that slow neutrons. B. Lead, because it is highly dense and stops all forms of radiation equally. C. Glass, because it is transparent and does not absorb radiation. D. Copper, because it has high electrical conductivity. Answer: A. Water or polyethylene, because they contain hydrogen atoms that slow neutrons. Explanation: according to IAEA reactor physics guidelines, effective neutron shielding requires materials rich in hydrogen, e.g. water, polyethylene, borated plastic. Neutrons are best slowed by elastic collisions with light atomic nuclei, hydrogen and or CH. Option B is incorrect because lead is effective for gamma radiation but poor for neutrons. Option C is incorrect because glass does not provide neutron attenuation. Option D is incorrect because copper is not effective for neutron absorption. Reactor shielding combines neutron-absorbing materials, e.g. boron, with gamma shields, e.g. lead or concrete. Question 29. Radiation emergencies. Evacuation versus shelter-in-place decisions. Nuclear power plant accident has released significant amount of radioactive material into the atmosphere. Emergency responders must decide whether to evacuate nearby residents or instruct them to shelter in place. Which factor is the most important in determining whether evacuation is necessary? A. The type and quantity of radioactive material released into the air. B. The number of people living near the plant. C. The temperature of the nuclear reactor core. D. The cost of evacuating residents compared to keeping them in place. Answer: A. The type and quantity of radioactive material released into the air. Explanation: according to IAEA and NRC emergency guidelines, key evacuation criteria include airborne radioactive isotopes, e.g. iodine-131, cesium-137, radiation dose predictions, e.g. 50 MSV requires evacuation, wind direction and speed to predict contamination spread. Option B is incorrect because population size alone does not determine evacuation needs. Option C is incorrect because reactor temperature does not directly determine evacuation criteria. Option D is incorrect because safety decisions prioritize human health over cost concerns. In nuclear emergencies, authorities use predictive models to decide between evacuation or sheltering in place. Question 30. Radiation therapy. Brachytherapy versus external beam radiation. Patient is diagnosed with localized prostate cancer and is given the option of brachytherapy or external beam radiation therapy. Which of the following best explains the advantage of brachytherapy over it? A. Brachytherapy delivers radiation directly to the tumor with minimal exposure to surrounding healthy tissues. B. Brachytherapy is completely non-invasive and does not require any radiation sources. C. Brachytherapy is effective for all types of cancer, including widespread metastatic tumors. D. Brachytherapy eliminates the need for medical imaging during treatment planning. Answer A. Brachytherapy delivers radiation directly to the tumor with minimal exposure to surrounding healthy tissues. Explanation: Brachytherapy is a form of internal radiation therapy where radioactive sources, e.g., iodine-125, palladium-103, are placed inside or near the tumor, minimizes damage to surrounding organs, e.g., bladder, rectum. High radiation dose directly to the tumor compared to ED. Option B is incorrect because brachytherapy is invasive. It requires placing radioactive seeds or catheters. Option C is incorrect because brachytherapy is mainly used for localized cancers, not metastatic disease. Option D is incorrect because imaging e.g., ET-RI is essential for treatment planning. Brachytherapy is commonly used for prostate, cervical, and breast cancers due to its high precision and effectiveness.